Hello, Catherine Massier. My name's Grace Massier, and I'm going to be your nursing student helping you out today. I understand you're here for a physical. Do you have any questions before we begin the physical today?
No, I don't.
All right, I'm going to perform hand hygiene, and I'm going to provide privacy, so I'm going to close the curtain of the door. So I'm going to start by asking some questions before we start the physical assessment today, if that's okay.
Okay.
I'm going to start off. Do you have any direct concerns?
I don't.
Here today?
I don't.
What's the main reason you're here today?
I need a regular physical for my job. We found out that I haven't had one for several years, so they wanted me to have a physical.
Are you on any medications?
I am not on any prescriptions.
Do you take any over-the-counter medications?
Sinus medications or allergy pills fairly regularly, and then if I have a headache, I'll take something.
What kind of things do you take for your headache?
Oh, Tylenol or ibuprofen or acetaminophen, whatever I have around.
Perfect. Do you have any allergies?
I do. The allergy pills are mostly for seasonal outside things. I'm also allergic to dogs and cats and cannot eat seafood.
Okay. Does your family have any health conditions or diseases?
My mom has high blood pressure, but it's well controlled with her medication, and liver issues, but she takes medicine for it too. My father died when I was a kid from cancer.
Do you use any nicotine or tobacco products?
No, none at all.
Okay. Do you consume any alcohol?
I drink about a glass of wine a night.
Okay. Do you have any serious, have you had any illnesses or any weight changes recently?
No illnesses. I've lost a few pounds recently in the last few weeks.
Has there been any lifestyle changes that might have led to the weight loss?
During the pandemic, I haven't been getting out of the house much, so I go walking most every morning, and that's really nice. It's also been a very hot summer, so I have not been eating much.
We're going to progress with this physical, but before we begin the actual physical, I'm going to ask you a couple more routine questions, if that's all right, and then we'll begin the physical.
All right.
Can you please state your full name for me?
Catherine Jo Massier.
Alrighty. Can you tell me where you're at?
I am in Des Moines, Iowa, in my house.
Perfect. Can you tell me today's date?
It is August 9th,
Can you tell
2020.
Can you tell me the season?
Summer.
Summer. Perfect. And can you tell me the President of the United States?
Trump.
Thank you. Have you been having any? We're gonna go ahead and I'm gonna ask you about your pain. Are you having any pain, or have you had any pain recently?
Nope, none.
All right. You mentioned you get headaches from your seasonal allergies. Do you have pain with those headaches?
A little bit.
What would you rate that on a scale of 0 to 10?
3, maybe 4.
Is that the top that your headaches go, or is that about average?
Generally.
All right, perfect. So, with so the patient is well groomed, looks healthy, looks adequate. Female patient, Catherine Massier, has no acute distress, is alert and oriented ×3, reports no pain, and seems perfectly fine and oriented. All right. So we're going to move on, and I'm going to do a skin assessment on you.
Okay.
Oh, and she reports pain when she gets her headaches of a 0 to 10, and she has her GCS as out of 15. So we're going to continue this assessment with the skin assessment. So can you pull up your pants to about here, please? You have to give me a little bit of it. All right. So first I'm going to check for the color, and then I'm going to the color of your skin, okay? All right. Just going to assess. Ooh, there's a bug on you. Sorry, there's a bug. Okay, see this? Perfect. Can you see arms, please? Good. All right. Next, I'm going to palpate for your skin moisture and temperature. So first, I'm going to do for temperature. Perfect. Was there any pain with any of that?
None.
Skin is dry and warm. I'm now going to palpate for edema. No edema is present. Next, I'm going to check for your skin turgor and elasticity, mobility. Do you have any pain with that?
No.
Perfect. That completes the skin assessment. Next, we're going to move, and so your skin there was proper turgor, so that means good hydration. Skin was warm, temperature-wise, and the skin was dry. So next, we're going to move on to the head and face assessment. Have you had any headaches recently?
No. Not for weeks.
Okay, perfect. I'm now going to palpate the skull and check for any lumps. And look for symmetry. Look down, please. There's a lump right here on the back of the skull, but the patient reported that as normal. Look up, please. Perfect. We're now going to look, and I'm going to see if there's any, I'm going to palpate for her sinuses. I'm going to start here. Tell me if you have any pain.
No pain.
Any pain?
None.
Okay. I'm also going to check the head for symmetry, making sure. Alrighty. So next I'm gonna have you make some faces for me. Would you please smile? Thank you. And frown. Perfect. Can I have you stick your tongue out? Move it side. Other side. Perfect. Her face, and I need you to puff your cheeks. Perfect. Her face is reactive. It's symmetrical. She has no limited movements. There's no obvious lesions. She did have that lump in the back of her skull, but that was reported as normal, not out of the ordinary. We're going to move on to your eye assessment. Okay. So I am going to check, have you had any vision changes, vision problems I should know about?
Nope,
Do you
none.
have contacts or corrective lenses?
No, I had LASIK surgery.
I need to be in it a little more. Okay, perfect. So I'm going to make sure your eyes are symmetrical, your eyebrows, they look symmetrical. I'm going to palpate your eyebrows.
Okay.
That's okay. Is there any pain?
No, none.
Okay, perfect. I'm going to also palpate under your eyes. Do you have any reports of dryness?
No.
No. Any pain?
No.
Okay. I'm going to detect the external ocular movement of your eyes. So I'm going to have you follow my finger without moving your head, okay?
Okay.
Perfect. Are you okay with me shining a light in your eyes to check the pleura of your eyes? This is where it's to see the reactivity of your pupils.
Okay.
This is a pen light. This is what I'm going to be using. It lights up just like that. It's going to be very bright for a second, but I will give you a chance to recover. Okay. I'm going to stand about 2 feet away from the patient, and you let me know when you're ready.
I'm ready.
Okay. Please look directly behind me at the picture on the wall.
Okay.
Ready?
Ready.
Perfect.
Okay.
All right. So pupils were reactive, her eyes were symmetrical, she had no pain with palpation, and the whites of her eyes upon examination were clear. There was no signs of arrhythmia or jaundice. Next, we're going to move on to the ear assessment. Have you had any hearing changes or hearing difficulties?
No.
Do you wear any hearing assisted devices?
I do not.
Okay, I'm going to palpate behind your ears, and I'm going to palpate so the anterior and the posterior of your external ear.
Okay.
Just tell me if you have any pain.
No pain.
Any pain?
Nope, none.
Next, I'm going to conduct a whisper test to check for her hearing.
Okay.
So I'm going to go like this, and I'm going to whisper. I would like you to repeat what I say.
All right. C6-7.
Perfect. I'm going to try the other side.
ACT.
Perfect. Hearing, she passed the whisper test. No pain when palpation. There was ears are symmetrical. There doesn't seem to be any deformities or lesions present when examining the ears, and there has been no auditory changes. Next, I'm going to examine the nose. Okay, I'm going to ask a couple questions, and we'll continue. Has your nose been runny or congestion more than normal? You said you were going on more walks, seasonal allergies.
A few more flowers out right this time of year, so a little bit of a stuffy nose, but not runny or anything.
Is the congestion painful? Does it cause?
No.
Okay. And when you blow your nose, is the mucus usually like a clear?
Yep,
Okay.
clear.
Perfect. I'm gonna palpate your sinuses.
Okay.
I'd like you to tell me if there's any pain.
Okay. No pain.
Okay, perfect. I'm now gonna check the patency of your nares. So I'm gonna have you put one finger like this, and I'm gonna have you breathe in, and then you can exhale for me. And other side. Perfect. Patency of nares is normal. When she breathes in, you see the flare of the nose, which is normal. So the next test that we're going to conduct is the mouth. So we're going to check her mouth and her throat. So first, I'm going to check her external mouth. You see that it's pretty symmetrical. Her lips are a nice pink color, so we don't see any problems there. I'm going to have you now open your mouth for me, please. I'm going to shine this in just so I can see in the back, okay? All right, go ahead and stick your tongue out and say, ah. All right, you see her uvula is reactive and moves up and down. Her tongue is pink and her midline is smooth. Her teeth don't show any signs of decay or abnormality formations. Tonsils are not present. She does have a history of getting her tonsils removed.
Yep.
Yeah. Next, I'm gonna have you, for your mouth exam, I'm gonna have you stick out your tongue for me and move it to side, other side, up and down. Tongue has full range of movement, so that is good. Next, we're gonna move on to the neck assessment. All right, so I'm gonna check the skin. I'm gonna check the skin of the neck, make sure that there's no lesions, abrasions, anything out of the ordinary. I'm gonna have you turn your head side to side for me. Perfect. Other side. I'm gonna have you look down, straight down. You try to touch your chin to your neck, and then I'm gonna have you lift your head up and look at the ceiling for me. I'm gonna have you turn your head and try to touch your ear to your, yep, perfect. And the other one, ear to shoulder. Perfect. I'm now going to check her neck for her lymph nodes. I'm gonna palpate her lymph nodes. We're going to start at the top of the neck behind the ear. Go down. This. Any pain?
No.
Okay. Her lymph nodes are hard. They have movement. There's no inflammation. I'm now going to palpate her carotid arteries. One by one. Right. Perfect. And I'm going to also palpate her trachea. Any pain?
No, none.
Perfect. So palpations were normal. I didn't have any, there was no pain while auscultating, and her lymph nodes seemed fine. I'm going to auscultate with with the bell of my stethoscope, and we're going to check her carotid arteries. So we're going to start top right side. I need you to just hold your head normal, please. Yep, perfect. All right. I'm gonna have you hold your breath while I do this as well, please. We have no abnormal swooshing sounds, so it sounds normal. Next, we're going to move on to her upper extremities. So we are going to check this. I'm going to start by looking over the skin color. Have you had any injuries to your shoulders, your arms lately?
No.
All right. Her arm symmetry looks normal. Go ahead and just stretch out. We're going to also check the range of motion, and I'm going to palpate the uppers, the radial, and then I'm going to check the fingers and push-pull test. So I'm going to start by palpating your arms. The color on the arms looks good. The only sign of difference is she has a birthmark on her right arm, on her right forearm. So now I'm gonna palpate. So go ahead and relax your arms for me. I'm gonna start at the shoulders. I'm gonna go down. If you have any pain, please let me know.
Okay, I'll tell you.
Perfect. Next, we're gonna do range of motion. So I'm gonna have you put your arms out for me. Move, go up, down, move to the side, down. And I'm gonna also check the. I'm gonna have you do a push-pull test.
Okay.
So I'm gonna have you
Push against you?
Yep, push against me. Perfect. I'm gonna push against you. Perfect.
Okay.
I'm gonna check the comes back in less than 2 seconds, so that's good. We have color. We have good capillary refill, and I'm gonna check and see if her brachial and radial pulses. I'm also gonna check her finger mobility. There are no signs of arthritis except right here. You can see there's maybe a little bit. Same with this finger right here. All right, I'm gonna check her brachial. I don't need this for that. What am I doing? Check your brachial and your radial arteries.
Okay.
Her radial artery, or her radial pulse. One right here. There's one right here. Good. I'm gonna check her brachial pulses. Good. All right, next we're gonna move on to the back and chest and lungs of the patient. Have you had any shortness of breath or cough symptoms?
No.
Have you had any back pain or injuries lately?
I have not.
All right. I'm going to inspect the thoracic cage. In a real life situation, she'd be in a gown, so I'd have a little more. Obviously, I'm not going to have her take off her shirt. But from what we can see from her thoracic cage is that it's normal. The symmetry is good. There's no obvious lesions or abrasions or marks on it. I'm then going to palpate down her spine. So I'm going to around here. I'm gonna have. Can you actually sit right here for this part? Sorry. Perfect. Okay. So I'm gonna pull up your shirt if that's okay.
Mm-hmm.
All right, just like that, and I'm gonna palpate down the spine. If there's any, are you having any pain?
No.
Perfect. Can you lean forward for me? You can see that there's no obvious curvature of the spine that's abnormal. All right. Next thing I'm going to do is I'm going to go ahead and I'm going to auscultate the patient's lungs. So I'm gonna go ahead and listen. We can turn it around. See the camera a little bit better. All right. So we're gonna start. I'm gonna go down over right here. First sound is in the S, between the S2. Can you come a little closer, please? Go ahead and take a deep breath in and deep breath out. Perfect. Now I'm gonna move down. This is hard to see because of her shirt. I'm gonna do it on the outside of her shirt because I don't want to do it on the inside. But go ahead and breathe in and out. I'm gonna do this. Go ahead and take a deep breath in. Good. I'm gonna have you take a deep breath in for me. Perfect. Then we're going to listen to the lungs on the back. I'm gonna do it on the outside of her shirt, and this is just for her privacy, or I can go down in between the back, but go ahead and take a deep breath in for me. Deep breath in. Deep breath in. Deep breath in. Now listen again, just down here, but I wanted you to see where my placement was. Deep breath in. Deep breath in. Good. Deep breath in. Good. Deep breath in. Good. Lungs sound clear. There's no signs of crackling or wheezing to be heard. Next, I'm going to listen to the heart. Have you had any change in beat? Have you had any change in beating of the heart?
No.
Or felt any weird heart, any chest pains?
Nope, nothing like
All
that.
right, so I'm gonna listen to your heart. I'm gonna have you breathe normally, okay?
Okay.
Okay. Come closer so we can see the spots. So we're gonna start this side. And so just go ahead and breathe normally. We're gonna start. There's 5 different areas that you want to listen to the heart. So.
Oh, breathe normally.
Huh? Yeah.
Sorry, I was taking deep breaths.
Okay. Are you ready?
Mm-hmm.
And this last one, I'm gonna do above the shirt just for privacy reasons, but it'd be on the lower chest. There's no, it does sound normal. You can hear the S1 and S2 sounds are present. There's no like bruising sounds that we should be concerned about. Next, we're going to assess the abdomen. In this, I will have you lay down farther in the assessment. I'm going to ask you a couple questions though. Do you have any trouble urinating?
No, no problem.
All right. When was your last menstrual cycle?
Year and a half ago.
Thank you. Do you have any trouble with bowel movements, irregular constipation, diarrhea?
No, nothing.
Okay, perfect. So, I'm gonna inspect the bowel, or the abdomen. Are you okay if I raise your shirt just a little?
Yes.
Expose the abdomen. Okay. So, I'm going to inspect the abdomen. I don't see any abnormalities. There's no abrasions, incisions. We don't see any ileostomies or colonostomies to be worried about. And she does not have a catheter. So I'm going to, after inspecting, I'm going to go ahead and auscultate. So I'm going to listen. So when you're auscultating as well as palpating, you want to go in a circle starting here, and you're going to go to the quadrants. There's 4 quadrants. Start this one. There's no abnormal bowel sounds present. Next, I'm going to palpate. You're going to palpate in a circular motion. Is there any pain without palpation?
No, none at all.
All right, perfect. So the belly is warm. There's no abnormalities seen. There was no pain with auscultation. Bowel movements are regular. So I'm gonna have you go ahead and sit back up, and we're gonna move to the lower extremities portion. Alrighty. Can you pull your leg pants up? Perfect. All right. So we're gonna check for color and symmetry again. Color, the only mark I can see right now while looking. Can you come closer this way? You can see on her knee, it's a mark. Did you have a fall? Or?
I did. I sprained my ankle about 3 months ago and also skinned up my knee, and that really hasn't gone away.
You can see, can you raise your foot for me? There's also a little bit of swelling still from where there was a sprain right here, just very minor swelling. And check the bottom of your feet, other foot. You can also see there's a few moles present. There's also a mole on the bottom of this foot right there. Toenails look fine. I can't check. She's currently wearing nail polish, so I can't check to make sure that her circulation or toes is okay, or her nails, but her fingers were good. So next we're going to, there's no swelling. Her hair growth is normal. She just shaved recently, she reported. So I'm going to palpate the popliteal and the dorsal. So it's behind the knees. It's hard to see in this video clip, but it's going to be located right back here behind her knee. You can find it. Sometimes they are hard to find. Just put a little more pressure, and now you can usually feel it. After palpating that, I'm going to do the posterior tibial and dorsal. So there's one right back here. And then dorsal would be located on the top of the foot. That one's a little more well known. Alrighty, are you having any pain?
No pain at all.
All right, so as we saw before, her capillary refills in her toes aren't going to be present because she's wearing nail polish. Next, I'm going to have you push back on me. So I'm going to have my hands like gas pedals. I'm going to have you push down like gas pedals. Can you come a little closer so we can see what she's doing? And I'm going to put, okay, perfect. And then I'm going to push back up against you. Nope, I'm going to push against you.
Oh.
Go ahead and just try not to move back. Perfect. Alrighty. Next, I'm going to move the legs out. So I'm going to have you move your legs out.
Like that?
Yep, back in. Perfect. Out. And back in. Perfect. So that is your abduction and adduction. You were supposed to be laying down.
Oh.
It's okay. So there's nothing concerning today. I appreciate your time and letting me letting me practice on you, and thank you very much. If you have any further concerns, or if you want to wait for the provider, I will go ahead with her. If you have any further questions, please let me know.
Okay, thank you.
Perfect. Thank you.